We've developed a follow-up service where we see patients about 3 to 4 months after they've been discharged from the unit home, just to see physically and psychologically how they're dealing with their daily needs.
So can you tell us, how was the need identified that you actually needed this service for your patients?
We're aware that as patients go through their journey throughout the hospital that they're well supported and followed up. However, once patients are discharged home, not all of them are aware that there are a lot of symptoms that can be caused by their critical illness, and once they're getting into the normal daily activities of living, we find that it's only then that these are identified to the relatives and to the patients. So we aim to try and support patients through these needs once they've gone home.
So how did it all get set up? How did you get involved? Did you have team meetings? How did you actually get it going?
The unit itself was developed in some research which looked at follow-up services and how they had been set up. Once we'd finished taking part in that research, we decided that it would be beneficial for our patients if we could form some sort of service to support our patients within these needs. So we, as a team within the medical staff, the physios, ourselves, the nurses, we got together and discussed what was the best way forward to set up a system to support the needs of these patients. With doing that, we decided a very flexible service would be the best way to do this, whereby we would invite patients back to a clinic service. However, if because of their physical demands at home or their psychological well-being they weren't able to attend intensive care setting, we've set the service up where we can actually go and visit the patients at home. If they're in hospital for other clinic needs, we'll go and visit them up there. Some of these patients don't actually want to come back to the intensive care setting, and because of that we try and be very flexible and support them within their needs. In terms of evaluation, what we're doing with our clinic is we ask the patients to fill a questionnaire out while they're sitting waiting to come in. We look at the HADS, which is the Hospital Anxiety Depression Tool, which is a very quick, easy one for the patients to look at, that gives me a very easy, quick look at how they're doing physically and psychologically. We also look at the Intensive Care Experience Questionnaire, and that gives us quite a wide perspective of how they felt about their time in intensive care. Some patients feel that they have no memories, but when they fill the questionnaire out, they actually do have an overall impression and have been left with a feeling of what's going on with them in intensive care. In terms of outcome, what we're doing at the moment is we're developing a tool to send to patients to ask them how satisfied they have been with the service, and for their comments to see if there's anything else that they feel that we would benefit from, or anything we could change to improve the service for them.